My name is David García Dorado, and I am the head of the cardiology department at the Vall d'Hebron Hospital in Barcelona, Spain. My talk has been on the role of cyclic GMP as a target to reduce reperfusion injury in patients with ST elevation myocardial infarction. Patients with ST segment elevation myocardial infarction usually have an acute and complete coronary occlusion with little or no collateral flow. And under these circumstances, cells start to die very early after occlusion. And when reperfusion is performed by primary percutaneous coronary intervention or thrombolysis, a lot of cells are already dead. In addition, the efficacy of reperfusion is reduced because it produces additional cell death. So the final myocardial salvage is less than it could be. And this phenomenon is known as reperfusion injury. And we know that this cell death can be prevented experimentally by interventions applied at the time of reperfusion. And there is a lot of preclinical evidence showing that first, cyclic GMP is reduced in reperfused myocardium, and second, that its normalization interferes with most of the mechanisms responsible for cell death during reperfusion, for this so-called reperfusion injury. There have been clinical trials in which this strategy has been investigated, and they have been positive. And there are also other trials in which other strategies have been tested that indirectly result in stimulation of cyclic GMP. This happens in post-conditioning, which is intermittent reperfusion during the first minutes of reflow with reocclusions of the artery, or remote ischemic conditioning, or different drugs that have been administered successfully at the onset of reperfusion. In addition, we have just finished a clinical study with adenosine that also increases cyclic GMP availability, and we have obtained quite promising results. So we think that now it is time for to conduct large clinical outcome trials that could eventually bring these therapies to patients with ST elevation myocardial infarction.